So what is EFT? In this video, I want to talk to you about emotional freedom technique, also known as EFT or just tapping. Now, emotional freedom technique is a remarkably effective melding of ancient Eastern medicine and cutting-edge modern Western science, resulting in a healing technique, a healing modality that accesses unseen energies of the body and the power of the subconscious mind. Now, the foundation of this technique comes from two Chinese healing and well-being systems. Now, one you may have heard of is called Qi Gong, which loosely translates to life force energy work. And the other is Chinese acupuncture, which uses needles at various points in the body to unblock energy channels or energy meridians. These energy channels course through the body like blood vessels do. Now, these energy channels may become blocked and the energy becomes stuck and stagnant, which can lead to stress, discomfort, even disease in the body. Now, by stimulating certain points along the energy channels using acupuncture, the energy becomes unblocked and flows again, leading to feelings of peace and calm, even reducing or eliminating physical pain and physical symptoms. Now, of course, we're not going to be using needles to stimulate the energy points. We're going to tap on these acupuncture points, a variation called acupressure. And just to be clear, I am not an expert on the energy system of the body. I am not an MD. I'm not a physiologist or a psychologist, let alone an expert in Chinese medicine or acupuncture. I'm a hypnotherapist and a mindset coach, but what I do know is that I've seen it work in my life. I've seen it work in the lives of my clients I teach it to, and I have the scientific research to back up all this, including research on alleviating PTSD in veterans. And there's even research showing using EFT can eliminate anxiety. And so we'll get to that in a minute. Now, interestingly, you may already be aware of this energy system and acupuncture. You may even be using it in your life, you just didn't know it. So has anyone ever recommended pressing on this point in the fleshy part of your hand between the thumb and index fingers to remove a headache or pain? This is an acupuncture point, but instead of a needle, you are pressing on it, therefore acupressure. Or maybe you or somebody you know has gone on a boat ride, maybe a harbor cruise, a sunset cruise, or a fishing trip. And you are the person you know, you went to the drugstore and you got one of those seasickness wristbands. And those wristbands, they have a little bead, a little plastic bead that presses in to the acupuncture point in the wrist related to nausea relief. So instead of a needle, you're pressing on it, acupressure. Now, the concept of the body's energy system and in this ancient Chinese medicine system is way too complex and goes way beyond the scope of what we're talking about here. But with the internet at your fingertips, there's lots and lots of information out there if you want to do a deeper dive into acupuncture, into Qi Gong, into Chinese traditional medicine. Also, there's going to be a reference guide on this page. You can download a PDF with references to the research and some of the other things we'll be talking about, including PDFs on actually how to do EFT, not only the full system, but also for your fingers. So I'm going to go over some research studies in a minute here, and you can actually download a PDF of some of the research related to EFT and go ahead and look at those up yourself as well. And it's really fascinating stuff. And this stuff is not only done by researchers specifically in the field of energy therapy, but also places like Harvard Medical School. So how does tapping or EFT work? As I continue with this video, I may sometimes refer to emotional freedom technique as either EFT or tapping. Just know I'm talking about the same thing. So, as I said before, EFT can be used as a simple but powerful tool to reduce anxiety by specifically targeting acupuncture points that reduce intensity of emotional upset and even reduce physical pain and reduce physical symptoms. So, what's going on in the body? What's going on in the brain when you tap on these energy channel points, these acupuncture points? One of the earliest neurological explanations for how acupoint tapping, is another way to say it, might produce therapeutic change was based on the findings of a 10-year research program at Harvard Medical School investigating the effects of acupuncture. Now, among the research team's conclusions was that stimulating selected acupuncture points generates extensive deactivation of the amygdala and other areas of the limbic system in the brain. This is from the study. Functional MRI and PET scan studies on acupuncture at commonly used acupuncture points have demonstrated significant modulatory effects of the limbic system, paralimbic, and subcortical gray structures. This is a fancy way of saying acupuncture can affect those parts of the brain that create stress, anxiety, and fear. Now, another study explained why that is. It says, quote, manually stimulating a set of acupuncture points decreases activation signals in the areas of the amygdala and other brain structures involved with fear. Now, these effects are virtually instantaneously, as shown by the MRI and PET scan studies. So, to dive in a little deeper on how this works, tapping utilizes elements of cognitive behavioral therapy, exposure therapy, and somatic therapies. In the first two steps of this process, you are going to engage the frontal lobe of your brain as through traditional talk therapy, although you're just talking to yourself. As you begin to tap on these acupuncture points, you send a signal to the brain to relax, which results in a calming effect on the amygdala, the stress center of the brain, as well as the hippocampus, the brain's memory center, both of which play a role in the decision-making process to determine if something is or isn't a threat and turning on the stress response, the fight or flight response. So by tapping on these acupuncture points you'll see in later videos, you're releasing the bad kinesthetic feeling in the body from the visual memory and the auditory memory so that a person could then consciously access a previous traumatic memory without the feelings of hurt or pain. You're sort of disconnecting and unplugging the visual, the auditory, and the feeling state from each other so they don't affect each other anymore. So, how does EFT therapy work? Since the development of EFT, over 100 articles, 100 research studies have been published demonstrating the effectiveness of tapping. I'm going to go through just a handful of the research, and you can go even deeper and find all the citations for this published scientific research by reading the PDF titled EFT Research that you can find on this page and download that and go down an amazing deep dive into the research. It's fascinating. I want to start off with research from 2020. The prestigious American Psychological Association published a study showing that tapping appears to be effective in not only reducing the psychological symptoms of burnout and stress, but also in reducing the biological markers for stress. The study showed that cortisol, the main stress hormone, is significantly reduced after a session of tapping. Now, in fact, the research showed that a single hour of tapping is an efficient and effective treatment for reducing psychological distress, such as anxiety and depression, by reducing the overall severity of symptoms through reducing the biochemistry of stress. Specifically, this research showed that tapping the acupuncture points while repeating a reminder phrase significantly decreased the stress hormone cortisol. Amazing stuff. And that the American Psychological Association is publishing this stuff is absolutely astounding. And high levels of cortisol have been linked to numerous physical health conditions, including reduced immune function, cardiovascular disease, and even stroke. It's also been linked to mental health conditions such as anxiety, depression, and post-traumatic stress disorder, PTSD. So by reducing cortisol levels, it is possible to increase both physical and mental health and reduce symptoms in the symptom intensity and also the frequency of those symptoms. So here's another study. This is actually, we're going to be very specific, one on test anxiety. Research has specifically looked at the effectiveness of tapping and reducing test anxiety, being anxious about taking a test or exam, and finding that it was as effective as a technique of progressive muscle relaxation, a deep relaxation of muscle by muscle. Now, student volunteers in the study who learned tapping also improved their test scores and reported less emotional worry and stress. Here's a study just on tapping for anxiety. Tapping helps significantly reduce symptoms related to anxiety. One study compared EFT to cognitive behavioral therapy found that 90% of those who received EFT had significant improvement in their symptoms compared to only 63% of those who received cognitive behavioral therapy. Additionally, tapping was effective without any augmentation from medication. And it only took 3 sessions for EFT, for those symptoms using EFT to improve as compared to 15 for cognitive behavioral therapy. Incredible. Also, reduction of anxiety symptoms was maintained after EFT treatment, with one study showing participants still experiencing reduced symptoms 3 months later. Depression. You can use EFT for feeling depressed. A review and meta-analysis of studies on the effects of EFT in reducing depression found that tapping reduced symptoms by 41%. It also found that the positive effects of tapping were larger than the effects seen in antidepressant drug trials. And like in tapping for other mental health conditions, symptom reduction was sustained over time. So just tapping on it, months later, you're still feeling great. Let's look at PTSD, post-traumatic stress disorder. Studies that looked at individuals experiencing multiple mental health conditions, such as a combination of anxiety, depression, and post-traumatic stress disorder, have found that tapping helps reduce symptoms for all 3 of those issues. Integrating tapping into treatment for post-traumatic stress disorder has been shown to significantly reduce symptoms including flashbacks and nightmares, insomnia, trouble concentrating, isolation, hypervigilance, and aggression. And in one study, survivors of the Rwandan genocide were treated with a single session of tapping. After treatment, PTSD symptoms were significantly reduced and improvements were maintained at a 2-year follow-up. Incredible. This is incredible stuff. A study with veterans suffering from post-traumatic stress disorder found similar effects. After 6 sessions of tapping, 90% of participants no longer met the criteria for PTSD. And these improvements were, again, maintained at a 6-month follow-up. So EFT for other mental health issues. Studies have been found that tapping can help address specific phobias, both reducing the anxiety related to the phobia and increasing the ability to approach the object of the phobia. So, like maybe water or getting on an airplane. Another study found that a single session of tapping resulted in treatment gains that were maintained 6 to 9 months post-treatment. All right, that's great. That's emotional stuff, some mental issues. What about chronic pain? What about physical issues? This has been incredible research so far, but get this. EFT is shown to be in help with chronic physical pain. So a study with individuals suffering from frequent tension type headaches found that routine tapping twice a day for 2 months reduced both the frequency and the intensity of tension headaches. And another study focused on acute pain in individuals who had undergone surgery. Those who received 5 minutes of tapping for 3 days post-surgery experienced significantly less pain than those who received no tapping treatment at all. It's incredible stuff. In another study, patients with fibromyalgia participated in an 8-week virtual program. They're doing it over Zoom. And they were doing EFT sessions from their homes over the internet. The research found that various mental and emotional aspects of chronic pain, including rumination, including magnification, and helplessness were reduced, as were symptoms of anxiety and depression. And at least another 100 research studies over the decades have shown the efficacy of acupuncture, acupressure, and EFT. This is all incredible research, and the amazing thing is, you don't have to believe it. You don't have to understand it. It works anyway, and if you do it, and you will see, sense, and feel results that will be mind-blowing to you. Because as you're tapping, you'll feel the emotional upset fading and drifting away. It's amazing. Many people have had great results using EFT for anxiety, insomnia, allergic reactions, even physical pain like headaches or joint pain. So whether you're dealing with emotional issue, maybe a physical issue, try EFT and see the results. Now, this isn't to say don't go to the doctor or the hospital if you're in distress. If you're having severe abdominal pain, don't tap on it. Go to the hospital. You might have to have appendicitis. You may need surgery right away. Be safe with these techniques that I'm showing you. Always check with your doctor first. Always, always, always check with your doctor or medical professional before stopping any sort of treatments, any sort of medications, or starting a different diet or exercise program. Always check with your medical professional. And if your intuition is telling you to go to the doctor, absolutely go to the doctor. Now, in the next video, we're going to go over a brief history of where this technique of tapping on acupuncture points came from in the modern world, in the modern times. And then in the third video, we're going to actually show you how to do this process for tapping on anxiety. We'll go through the points and we'll do a run through on how to do this and even give you a couple variations to make it even faster.